Fred Hutchinson Cancer Center is the world-leading organization in cancer care, and specifically when it comes to bladder cancer, we have a spectrum of approaches from all the way from diagnosis, and Dr. Wright here is leading the efforts from the urologic oncology side. How do we do early diagnosis of bladder cancer when symptoms occur, and also even in terms of prevention, how we can actually think about avoidance of environmental risk factors and exposures to chemicals that actually can increase the risk of bladder cancer. And Dr. Wright is leading great work in the state of Washington, which is very relevant in control of these environmental risk factors that can increase the risk of bladder cancer. There may be occupations like firefighters, machinists, factory workers, hairdressers that may be exposed to those chemicals, and we have to be very, paying close attention so we can diagnose early if any symptom occur. We're also working on screening for bladder cancer. Fred Hutchinson Cancer Center here with Dr. Wright and our team are working hard to develop in the future screening methods that are more effective. Right now, we're not having a good screening test. And of course, I have to always highlight the important role of the Fred Hutchinson Cancer Center in the treatment of bladder cancer, all the way from early, more superficial, not muscle-invasive bladder cancer, all the way to metastatic urothelial cancer, which is the most common form of bladder cancer. And we're doing a lot of innovative trials, practice-changing trials that will change the way we actually treat this disease all along. So we're very excited about this. Jonathan?
Yeah, I think you really hit all the high points that we go from the very early aspects of bladder cancer to the advanced and comprehensively provide that. I think one unique thing that we have here at the Fred Hutch and the University of Washington is the multidisciplinary bladder cancer clinic. And we built this clinic this way. It's serving as a model for others across the country, across the globe too, to how to bring together for those with muscle-invasive bladder cancer 3 different clinicians: the medical oncologist, the radiation oncologist, the urologic oncologist, then bringing in our pathologist, our radiologist, other support teams to come together in one-stop shopping to provide patients with the best guidance on care. And not only does it, we think, provide for better care, but it's also one environment for us to work together. And I think the other aspect of the multidisciplinary is the patient themselves. And Dr. Grivas talks about the research. The research couldn't be done without the engagement and the participation of our patients and their families too. So I think collaboration, multidisciplinary, this is what Fred Hutch is with bladder cancer.